A sister says, it's been about 50 days since I had a late miscarriage. I'm still bleeding. When do I stop praying again? The answer for this first portion of the question, first of all, we have to look at the miscarriage. If a woman aborts or miscarriages her pregnancy like before 80 days, then the blood that is coming out, this is considered nothing. It's not postnatal bleeding, and hence she should pray, fast, and offer wudu the moment the adhan is given. And the blood is najis, but she does not refrain from fasting, praying, or even intercourse with her spouse. If the pregnancy that was miscarried 120 days old or more, this is definitely postnatal bleeding. Between 80 days and 120 days, we have to look at the fetus that came out. If it had the features of a human being, arms, legs, and a head, then it is postnatal bleeding. If it's only pieces of flesh and meat, then this is blood that is not part of the postnatal bleeding, and she has to fast, pray, and the rest of that. What about if it's postnatal bleeding? If it's postnatal bleeding, then the max for it is 40 days. If she becomes pure before that, she has to perform ghusl and pray. But if the blood comes back again within the 40 days period, she has to refrain and consider that to be postnatal bleeding, and so on. Once the 40th day is due, she performs ghusl. Even if the blood is coming out, this becomes a blood that is facet, that is not part of the postnatal bleeding. The second part of the question says, I started to pray after 40 days. Now, this is subjective to whether it is postnatal bleeding or not. I went in hospital today, and they said I still have some placenta left inside. They have to operate to remove it. They said I'll be bleeding for few more weeks. How should I pray, and when do I stop? What if I start my menses while I'm bleeding? In this case, she is to be treated as a mustahada, and the blood that's coming out is considered to be istihada because it's continuous. A woman cannot have her menses more than half of the month. So 15 days is the max. If it continues, she has to perform ghusl and pray, and consider that bleeding to be dam fasad, damun fasid, which is not part of her menses or postnatal bleeding, but it is just like a wound. Now, if she does this operation, the doctors would most likely tell her that this is not your menses, and that this is a bleeding due to the operation. And hence, she has to pray her 5 daily prayers, performing wudu after each adhan, not before the adhan. And she's considered to be mustahada, and this is called istihada when the blood is continuous and it's not her menses. What happens if she does get her menses through these weeks of bleeding? In this case, her menses would be recognized by certain characteristics: the change of color and smell of the blood, the back and stomach aches, and she knows her usually time of the month where she gets her menses. Then she should consider this to be part of her menses, the specific 6 or 7 days, and then she continues to be following the rules of istihada as before.